Melatonin. It's a hormone that's not just for a sleep aid. I'm Dr. Nathan Goodyear, Medical Director here at Brio-Medical in the beautiful Scottsdale, Arizona. Melatonin is one of those hormones that everybody looks to help themselves sleep. Now, our body naturally produces this hormone from the pineal gland. But more than just its help in sleep, it has powerful anti-cancer effects, both individually, but also in combination with other therapies. Melatonin is released from the pineal gland at night. Its peak concentration in the blood is at about 3 a.m. at about 80 to 120 picograms per milliliter, and it's low during the day at less than 10 to 20 picograms per mil. So high during the night, low during the day. Okay? Cortisol actually has a flip, and this helps to set our circadian rhythm. But what's interesting about it, beyond just its sleep benefit, it has powerful anti-cancer properties. Tons of research affirming this, not just what it does, but how it does it, and reproducing those results time and time again. Melatonin follows a similar pattern as vitamin C, as a hormotic therapy, meaning at low dose, vitamin C is antioxidative. At high dose, it's pro-oxidative. Melatonin follows the same pattern. Low dose antioxidative, high dose millimolar concentration, pro-oxidative. Now, when you take melatonin by mouth, the reason why it helps you to get sleep really quickly, it has very low bioavailability. Its half-life is very short, and that's because it's quickly metabolized by the liver and it's eliminated. So it gets you to sleep, off you go, and then the body clears it out and you go into a nice, normal, deep sleep pattern. But what we're doing here with cancer is we're using melatonin in a very different mechanism of action. So first is the classic, what we call omics. When you look at melatonin, it has broad omic effects, and I've talked about this many places before. I've talked about how genomics, epigenomics, transcriptomics, proteomics, metabolomics, and immunomodulomics are the future of medicine now. Here we're talking about integrative medicine. Melatonin has very specific effects in epigenomics, in transcriptomics, in proteomics, in metabolomics, and in immunomodulomics. So through the 6 of those, melatonin is working through 5 of them. Specifically, cancer is going to work in areas such as initiation, promotion, and progression. So I want to touch on promotion for just a second, and then we'll get into the promotion and the progression. So the initiation, I want to talk about initiation, and we'll talk about promotion and progression in a second. Initiation, when you look at the World Health Organization, they have labeled night shift working as a carcinogen. They've looked at this in nurses that work night shifts. They've looked at it in airline stewardesses that fly overnight. It increases cancer production. Now, why would that be? Well, research has shown that when melatonin is low, there's an increased risk of cancer. Now, when you look at breast cancer research, what you find is not only does low melatonin because you're not asleep at night, it hits your immune system in a very negative way. But if there's breast cancer present, or if there's cancer present, poor sleep or melatonin defects are going to aggravate that. So when cancer cells are present, breast cancer cells are present in a woman with breast cancer, or a man with breast cancer for that matter, at night, the classic Warburg effect, where cancer is using sugar and doing so in a very inefficient way, that Warburg effect, that glycolysis effect, basically dampens down a little bit because of the melatonin. But during the day, as melatonin levels naturally drop, what we see an increase in the Warburg effect in the cancer cells. Because it's really interesting that in the process of the Warburg effect, where glucose no longer can go through all of these metabolic pathways to produce energy, it gets diverted. By its diversion, it diverts it away from being able to make melatonin as well. So actually, when you look at cancer cells, not only do they have Warburg effect ongoing in many of them, but they don't produce melatonin. So what we see here is that in cancer cells, at night you actually have a decrease, a dampening of that glycolytic effect, that Warburg effect. But during the day with melatonin low, it upregulates. But really interesting, they've looked at people that don't sleep well, or they've looked at animals also in animal studies that don't sleep well. What they found is if they don't sleep well, there's an increase above baseline of the Warburg effect during the day, and it maintains itself into the next night. So that's why sleep is so important, not just in preventing the initiation, as the World Health Organization has talked about as it relates to a carcinogen, but also how it plays a role if cancer is present. Now let's talk about promotion and progression, because here's where melatonin really shines. And remember, it's a hormone. So we need to dose this not in a way to induce sleep, but a way to induce an anti-cancer effect, and the research guides us there. First effects in promotion and progression is it's anti-proliferative. This is anti-growth. Melatonin inhibits very specific pathways. We know it inhibits growth, but we know exactly how it does it. P13K, AKT, mTOR pathway is a very important pro-growth pathway that melatonin turns off. It downregulates. It also arrests cell cycle mitosis. So, back in old, high school or junior high biochemistry, there was that mitotic pathway. And melatonin arrests that. It stops it, and it keeps it from going through there and duplicating a new cell. Number two, it promotes apoptosis. So melatonin promotes programmed cell death. And again, we know the mechanisms of how it does this. It does this through promoting certain signals, BAX, versus inhibiting what's called BCL2. So we, again, understand the mechanisms here, not just what it does, but how it does it. It counters hypoxia. And hypoxia is that lack of oxygen that really dominates within the tumor bed and tumor microenvironment. And that triggers hypoxia-inducible factor 1 alpha that really promotes angiogenesis. And melatonin counters hypoxia. It actually pushes oxygen into the tumor. Melatonin does. And it also counters angiogenesis. Angiogenesis is that tortuous blood vessel supply growth that is created by the tumor desperately trying to meet its metabolic demand for nutrients and elimination of waste. So melatonin targets hypoxia, melatonin targets angiogenesis. A big effect of melatonin is in oncogenic metabolism. This is the metabolic changes that we often see in cancer, and everybody focuses on the Warburg effect, and rightly so. Otto Warburg really helped us to really understand a lot of what was going on in cancer. And the Warburg effect is where cancer takes sugar, and instead of sending it through glycolysis down to the Krebs cycle electron transport chain, it diverts it away from the Krebs cycle and the electron transport chain and pushes it towards lactic acid production. And that's an oversimplification, but it changes enzymatic function. Melatonin directly counters that. It actually it inhibits pyruvate dehydrogenase kinase, an enzyme that, guess what? So does vitamin C inhibit, and so does DCA. And by inhibiting this enzyme, glucose gets converted to pyruvate into acetylcoenzyme A and then goes on down those pathways to then promote oxidative stress, which freaks out the cancer cells. They can't handle it. Also, that inhibits lactic acid production. Melatonin inhibits lactate dehydrogenase type A, which prevents glucose getting converted to lactic acid. Now recognize that lactic acid is not just to produce an acidic environment around the tumor and the tumor microenvironment. There are some cancer cell types that are called oxidative cancer cells that they will take lactic acid up and use it and convert it back to pyruvate and use it to make energy. So this goes both ways. What's also really interesting, and I've talked about this as it relates to vitamin C, cancer cells upregulate GLUT receptors. This is the ability to take types of vitamin C up and sugar. But when you look at melatonin, it competes for sugar at these GLUT receptors. So cancer cells upregulate these GLUT receptors, but melatonin comes in and competes with sugar to go through those. And that's really important because it allows you to starve it. As I mentioned already, it pushes oxygen into the tumor and tumor cells, and oxygen is required to have a pro-oxidative effect with vitamin C and melatonin to kill cancer cells. It also inhibits the calcium uptake of the cell cytosol and the mitochondria. By inhibiting calcium, you can actually trigger internal dysfunction and cancer cell death. Melatonin also inhibits invasion, and this is really important, not just in a physical aspect, but also in an immunologic aspect. Invasion is a physical aspect, and here via things like matrix metalloproteinases and COX-2. Specifically, melatonin comes in there and inhibits both. Melatonin is a natural COX-2 inhibitor. But immunologically, melatonin also comes in and inhibits immunologic invasion as well. And what's important about cancer as it starts to invade is it starts to change its behavior from an epithelial to a mesenchymal type effect. And what this literally means, this epithelial to mesenchymal transition, it means that it's going from, the cancer cells going from a very stable, non-mobile, to a very mobile format. So this allows it to spread. And melatonin inhibits this epithelial mesenchymal transition process. And it does it, again, specifically through a variety of ways. It stabilizes and increases E-cadherin. It inhibits vimentin. So again, we don't just understand the general concepts here, epithelial to mesenchymal transition, we understand how. And so by inhibiting this epithelial to mesenchymal transition, melatonin is also anti-metastatic. It's helping to prevent cancer cells from moving from a primary tumor and spreading throughout the body. And this is important because if a new tumor cell starts to land and develop a new tumor in a distant site, that metastatic potential increases the morbidity and mortality associated with cancer. In fact, 90% of morbidity and mortality associated with cancer is because of metastasis, and melatonin specifically inhibits that process. Melatonin also inhibits inflammation. It's anti-inflammatory as it relates to cancer. It inhibits nuclear factor kappa beta activation, activity, and even binding to the DNA to promote inflammation. I've written and talked about before how the spike proteins from the SARS-CoV-2 combines with lipopolysaccharide associated with metabolic endotoxemia to increase 50-fold the inflammation systemically in the body. Melatonin comes in here and inhibits this lipopolysaccharide metabolic endotoxemia that comes from the gut, that goes through these toll-like 4 receptors and triggers systemic inflammation. So melatonin is not just useful in reducing systemic inflammation in cancer. You can use it for viral infections, so here talking about SARS-CoV-2, or any flu, common cold, coronavirus, whatever. Melatonin is very effective there when dosed correctly. But probably the most powerful effect, I think, because really when you look at cancer, it's moving away from what's going on inside the cell, which is still important, but what's going on in the immune system in the tumor microenvironment. Melatonin is an immunomodulatory therapy. And what's interesting about cancer as it relates to the immune system, it's almost behaving like an autoimmune process. It recruits the immune system to it into the tumor microenvironment, and then it turns the immune system on the immune system. And so what happens is immune cells that get recruited there start to become immunosuppressive on other immune cells coming in there. And thus the cancer starts to evade the immune system. And this is actually a very key component in how cancer spreads. It diverts or subverts the immune system, which is immune evasion. It's not just a physical, it's an immunologic evasion. So what melatonin does is it actually increases the immunologic effect against the cancer by increasing CD8 cytotoxic T lymphocytes. It increases interleukin-2 signaling, which is an immune signal that increases natural killer cells, which do exactly what their name implies. They naturally kill cancer cells. But what it also does, it also inhibits the suppressive immune system effects within the immune system. It inhibits what's called TGF-beta, and this this inhibits the immunologic suppression you see in the tumor microenvironment. It affects and impacts the cancer-associated fibroblasts. It suppresses the myeloid-derived suppressor cells that come in there. And so essentially what happens with melatonin, it breaks the immunologic suppression that occurs in the tumor microenvironment. It allows immunologic support and stimulation that can be anti-cancer and allows the immune system to do its job, which is to protect the body against all enemies, foreign and domestic. And of course, cancer falls into the domestic category. So the immunomodulatory effect of melatonin is probably, I think, one of the more profound effects. And this, in turn, combines with other therapies like vitamin C, hyperbaric oxygen, and hyperthermia, all doing the same thing. Thus, stacking these therapies together is very effective. Now, here's something that does take some people by surprise, is that melatonin has hormonal effects. Well, seems to make sense. Melatonin is a hormone. It does induce sleep, but here I'm talking about melatonin's effect on ER-positive types of cancer. So most cancers that are ER positive we think of is breast cancer. So let me tell you how research shows us this is happening. Melatonin actually downregulates ER alpha expression. When you see an ER positive cancer, it is primarily an ER alpha. Melatonin suppresses that. And what happens is that when estradiol binds to that receptor of estrogen, it goes down to the DNA and starts to encode genes into proteins. And melatonin not only decreases that receptor, but it also inhibits the process by which that receptor that binds that estrogen goes to the DNA to encode proteins. That's really, its effects are not only metabolomically there, but it's also epigenomically, transcriptomically, and proteomically. So it's really affecting many different ways there. But also melatonin is an aromatase inhibitor. And aromatase is the enzyme that converts male hormones to estrogen. And beyond menopause, that is the primary mode of estrogen production. But this occurs in other cancer cell types, not just in breast cancer. So melatonin's anti-cancer effects are in part hormonal as well. I touched on this right in the beginning of this video, but melatonin is pro-oxidative. Now what's key here, just like with vitamin C, is the dosing. High dosing of melatonin is very important to achieve the pro-oxidative effect, because at low doses it's going to be antioxidative. Now at the pro-oxidative level, the effects of melatonin are primarily occurring via two ways. One, it's increasing the oxidative load by pushing the cancer to make sugar through the full aspect of what's called oxidative phosphorylation. And that creates a lot of oxidative stress, and that's going to deplete the cancer cell's ability to handle it through depleting of detoxification enzymes. So it promotes oxidation and it depletes the cancer cell's ability to handle it, and so thus it promotes a pro-oxidative process overall. Also, it's going to inhibit cancer stem cells. Primarily, it's going to work to inhibit what's called cancer cell stemness. Now, cancer stem cells are those backup copies of cancer cell that we want no part of. They behave very differently than cancer cells that lack stem activity. They can actually process sugar and other macronutrients, such as fat and amino acids, almost like a normal cell. But they're that backup, and they can morph and mutate into a cancer cell without stem activity if needed. They play a central role in metastasis and actually in treatment failure. And melatonin actually inhibits cancer cell stemness. So melatonin's inhibiting that backup copy that we want to get rid of. More than just melatonin as an isolated therapy in the treatment of cancer from a holistic and integrated perspective, melatonin is a great stacking therapy, a therapy that can be used together in combination with other treatments, because that's the best way to go after cancer. Cancer doesn't occur because of a magic bullet. It doesn't occur of one effect. Thus, it can't be treated just with one effect. You have to bring and stack and sequence and combine these therapies together. So melatonin research has shown to work well in conjunction and in combination with vitamin C. And you can see when I talked about melatonin, when I talk about vitamin C, they have lots of common effects together. Melatonin also works great in combination with DCA, dichloroacetate. Melatonin has been shown to be adjunctive and combination positive in a positive way with hyperbaric oxygen. Talked about how melatonin increases oxygen, so does hyperbaric. They're both pro-oxidative when dosed appropriately. Melatonin also works great with hyperthermia, increasing the pro-oxidative and cancer cell destructive effects. So there you see the stacking of these therapies together. And you can even see that in melatonin with some of the mainstream hormone therapies like tamoxifen. But more than that, melatonin should be used in conventional medicine. And I'm an integrative doctor. So I'm both a conventional doctor, MD, but also an MD homeopath. And what research has showed about melatonin is that when dosed high, it can augment chemotherapy and it can resensitize cancer cells to chemotherapy that it's become resistant to. It does the same thing to radiation, augments radiation, and it resensitizes cancer cells to radiation. But melatonin also augments immunotherapeutics. One of the immunomodulatory effects of melatonin is it actually inhibits programmed death ligand 1. This is a very important what's called immune checkpoint that allows the cancer cells to evade the immune system. And these are drugs that you've heard of that are called immune checkpoint inhibitors. And what happens is melatonin inhibits the ability of the cancer to evade the immune system. So melatonin works with immunotherapies from a conventional standpoint, but also from immunotherapies from an alternative or integrative standpoint as well. So you can see melatonin is not just a hormone to help sleep. Melatonin plays key roles in the initiation of cancer, in the promotion of cancer, not just broadly, but very specifically, and in the progression of cancer. But it also is a target as a single therapy, but more so in combination and stacking with other alternative holistic therapies, but also even with conventional therapies. So whatever approach you take in your healing journey, and here at Brio-Medical, we take a holistic, integrative approach. But if you're a patient that is following the complete conventional route, melatonin is something to ask your doctor about because it can help your therapies there. Here at a holistic integrative cancer clinic like Brio-Medical, it is a mainstay in everything we do, both oral and IV. That's the power of melatonin in the causation of cancer, but more so the treatment and healing from cancer. To learn more about other therapies we offer here at Brio-Medical to initiate and continue your journey in healing from this thing called cancer, I encourage you to go to our website, check out all the information there, the blog posts, the videos. I look forward to talking to you soon.